we welcome you warmly to Orlando.
The Association of Nigerian Physicians in the Americas has been doing this for 21 years, bringing onto the discussion table burning issues in Africa, particularly in the Nigerian health sector.
Very good listeners.
The current state of the Ebola outbreak in a few West African countries and lessons learned from the importation of the disease into Nigeria shaped these opening conversations of the three-day conference, which has other physicians in attendance.
People moving back and forth, and so maybe the funerals were part of it, but there is also other stuff. Why do people care for very sick people in their homes? Well, because number one, there aren't any health facilities to do so, and there's not a great amount of faith in those systems. I think that's human-to-human contact, human-to-human transmission has absolutely been the driving force.
One of the things that everybody kept saying is, if you think this is bad, wait and see what happens if it gets into Nigeria. And so I have to commend my colleagues here today from that country, who obviously proved most of the epidemiologists wrong.
There are many lessons. One of them is, how do you respond in a case where the patient wants and wishes to exercise their rights and exit your facility? There's only one superior provision that allows you to decline the patient exiting, but you must document it. And you have to be sure that you're doing it, you're declining in the public good.
Nigeria, sadly with casualties, but thankfully also survivors, contained the 2014 Ebola infection to earn her current WHO Ebola-free status. But the reappearance of the disease in Liberia, which was equally certified free of the virus, should send a strong signal of a possible reimportation.
One case is enough. Even if it's only one case in the whole world, we should consider ourselves in trouble. And then don't let your guards down, even after an outbreak. We're already beginning to do that in Nigeria. We don't have to.
We need health reforms. That's definitely basic, because our health system is in shambles. In Luth, people pay for their gloves, they pay for their spirits, they pay for their cotton wool. If they don't have those things, you can't touch them.
We were not really ready the first time, and I don't think we are ready for the second one, if it comes. So it's laying emphasis on certain structures like Center for Disease Control, and then also equipping not just at the federal level, but making sure that the state level and the primary care level and the local governments are very functional.
We need the government to, one, continue the public health care message that it's been delivering. Two, we need to improve the healthcare conditions of people, because at the end of the day, the spread of this disease has to do with poor hygiene, poor knowledge.
Discussions on healthcare delivery during conflicts, disasters and epidemics continue tomorrow, with a focus on managing victims of terrorist attacks. From the 2015 conference of the Association of Nigerian Physicians in the Americas, holding in Orlando, Florida, in the United States, Yomi Otaibu reporting for Channels Television News.